joining us today and is kindly leading our webinar. He's the medical officer for Grey Bruce Health Unit and is going to be sharing all of his knowledge with us and hopefully addressing a lot of those questions and concerns. So you supplied a lot of questions when you registered for today's webinar, so thank you. And we have worked those into today's presentation. If there are any questions that you have which we do not touch on today, there's a Q&A box which you are welcome to submit your questions in. We'll do our best to get to as many of those questions as possible at the end following the presentation. If we are unable to answer your question directly, we will supply you with an email address where you can reach out to us and we'll do some further research and get back to you with those answers. So I will go ahead then and hand it over to Dr. Arra.
Thank you. I really appreciate the opportunity and invite. I have Andrew is one of our managers who's taking the lead on the environmental health and specifically the reopening of Grey Bruce when it comes to businesses and other environmental situations, locations, and occupational locations. I'm going to share my screen. I have a plan for a presentation of maybe 20-30 minutes, then we'll open it for questions. And would you be able to see the screen right now?
Yeah, that's perfect.
So business reopening in Grey Bruce, and this is trying to move the slides to the next one. Disclosure, I don't have any relationship with commercial interests. I have not had any grants or research for the position I'm in, and have not dealt with any private sector. The private sector does not even know I exist. There is acknowledgement to the opening plan or de-escalation plans that are produced academically by Johns Hopkins, which is one of the most reputable, if not the reputable, public health school. And they have a medical school, that's where they're known for, then their public health school is even more reputable. There is credit for a physician in training who worked on a similar plan in Hamilton. The next slide, just to emphasize that I'm quite aware of the increased death by watching PowerPoint. So my goal is not to bore you out of your mind to see the most recent stats and the most controversial evidence. Rather, it is best to be had as a conversation. And I think Einstein said it best: if a person cannot say it straightforward and simple enough, they don't understand it well enough. So the next slide is what we all have in mind: successful reopening, and that's our goal. And for the ultimate goal of having healthy community altogether. There is important notes about the slides I'm going to put forward. There is nothing here that is a plan to go forward from Grey Bruce. The regulation and the law is as so. If there is a provincial order, the municipal or local authority, including the medical officer of health authority, cannot override that order. We can always restrict more, but we cannot override. And I get this question quite often that when are you going to release the restriction on this subsector or this business? And the simple answer, it's not a restriction that was put locally, it's provincially, so we have no authority in overriding it. If it is opened and going forward, something happened that requires us to restrict one part or the other, municipalities have the authority, medical officer of health has the authority. And the draft plans and the documents that I'm going to share forward in the slides are not the final plan. Rather, it's just an exercise for all of us to be ready when we receive the green light from the province and the final plan from the province. So the province is developing these plans. It is better practice in public health to provide information to the local businesses and the local activities and organizations to be ready for when the green light is given so they can hit the ground running. So everything is going to be shared here is not to be taken as this is a direction we're going to be heading in Grey Bruce, rather a prediction of the best assessment. And to my delight, the plans that we have seen from the province so far and the planning for these plans that's being shared with us is really consistent with best evidence and better practice. And so far, our prediction has been very consistent with the direction that the ministry is going through or with.
Dr. Arra, can I interrupt for one moment? Would you mind expanding your screen to PowerPoint mode, just in case people are on devices?
To PowerPoint mode, I have it extended.
Okay. We were thinking there would be a way to make it full screen because we can see the next slide sitting on the right. If not,
well,
I see the presenter screen instead of the displayed screen.
I'm looking for full screen, but Rob, can you help me find it? It's a different...
If you click the drop-down on display settings at the very top, there's an option there.
Which one?
Yeah, click that.
Click this?
Perfect.
Okay, thank you. Really appreciate it. So important, I wonder, should I go back to the previous slide for a second so people would see it if it wasn't obvious?
Sure, just for a quick moment if you don't mind.
Okay. I might have, so these are the important notes, basically disclosures that these plans are prediction. The primary goal going forward, many people think that public health is only about preventing cases. We are about preventing cases in the, we're early in March and April when the goal is to have control over the outbreak. However, we do have full control over the outbreak locally. The numbers that we have are very, relatively very positive to other areas of the province. We have zero death. We have zero death, which is an accomplishment for everybody around the table. The public has done the right thing. Public health provided the appropriate recommendation and compliance has been optimal. Going forward in the recovery of any pandemic is not to have the goal only to minimize death and mortality from COVID. It is the minimizing of both death and disease from COVID and disease and mortality from measures to respond to COVID. And the second primary goal is to achieve herd immunity, basically to have COVID behind us, completely not an issue. It would be similar to measles, where we have a vaccine, or if there's infection high enough to have herd immunity through infection and vaccine, we will go through life without thinking measles exist. So that will be the ultimate goal. But going forward in the first stages of recovery is balancing these two. And I get the question all the time, why are you not opening? And we need to, that there is going to be harm of restriction or the measures to respond to COVID. And I reassure the group, like I reassure any person I spoke with about the subject, our goal is the same. There is disease and death from measures related to COVID. And these are a few examples that some people might think about, others might not have thought about. Heat waves are going to be a reality in a few weeks and over the summer. And we know that the less affluent of us who might not have air conditioning would suffer from this. And usually they go to cooling centers, grocery stores. Right now in COVID, if we don't have the successful reopening, people will die from heat. Similar to social, domestic violence, mental health, economic factors, income guaranteed. If you Google any public health agency name with social determinant of health, which the factor that determines health top that list, guaranteed you will find income. And the income in our area is generally from the small business and family business that keeps the economy moving in this area, plus tourism. And both of them are restricted with COVID measures. So it is, from public health, better practice is to move as fast as we can in reopening, as long as safe and reasonable, responsible. So lessons learned from other countries. There are different countries in Asia that had full control and appropriate outcome and successful reopening so far, and they use the same thing that we have recommended: universal masking, other restrictions, physical distancing, and they have people go back to their business, to the workplace, children to schools. In Europe, there are different experiences. I'm going to touch base quickly on these things and to go to the meat of this presentation, which is the reopening recommendation and plan. In Sweden, they gambled on herd immunity, saying we need to get the 70% infection. They didn't restrict much. And last week, the results came out that they reached 7% of herd immunity, 7, which is not much different from other countries. But what they end up with, 4,000 plus deaths for a very small country like Sweden. And if you take it in relative to other Scandinavian countries, Denmark, Finland, and Norway, Sweden had 4,000 deaths. The other 3 had combined of 700 deaths. So reopening or allowing everything to be open did really not achieve the herd immunity that we're hoping for. And probably was retro in a rear view mirror was not the best approach they could have. In the US, we have seen different interventions, mainly the regional and the different state approach. And it's a big country, so states and regions have different size than our country. However, what we see as a result there might not be optimal. Herd immunity, just in terms of a term, there are different ways to achieve it. And the first one here is phased lift of restrictions, which is the staged approach that the province is going through, and it is a better practice. So that's the best way that is known to achieve this. Vaccine is not here yet. Probably the earliest would be by the end of the year. It takes 12 months to develop vaccine that's safe and effective. And there are different stages to it. There are many candidates, multiple. Like in the first month, there were 11 candidate vaccines. Not all of them are going to make it to the finish line, but there is a good probability we will have the vaccine by the end of the year. And hopefully in 6 months, it's going to be distributed for public use or available for the mass use. Dynamic physical distancing, nifty idea, academic, not probably applicable, which is to say, let's open it for 2 months, close it for 2 months. We know that control over the outbreak might not be optimal if we open it completely. And you probably, because of your profession, leading businesses, you would know that opening a business, closing it after 2 months is not an easy task and probably not cost effective. The other one, uncontrolled outbreak, let it just burn through. Again, Sweden tried that. It doesn't seem to be working so far. The final one is hammer and dance, which is hammer it for social distancing for 6 months, and it will be gone by that time. Again, the harm of stopping the economy for that long might outweigh the benefits. This is herd immunity related questions. How much herd immunity is necessary? It is definitely the optimal solution that we're going to end up with, unless if we don't want to live with this reality that we're living with now. How fast will herd immunity build? Depending on how fast the outbreak will go through, like I mentioned before, or getting the vaccine. How much herd immunity do we have right now? Probably less than 2%, less than 5%, depending on the area and the province. We have a really good success in controlling the outbreak, and we're, by definition, the victim of our own success, that the herd immunity will be low. How long will immunity to COVID last? I don't know that answer, and nobody knows that answer. And if somebody knows, they should go to Stockholm and Sweden, pick up their Nobel Prize. there is good evidence from looking at the family of coronaviruses that if there is a vaccine or infection, it's going to be lasting for months or few years, hopefully longer, but there is no really data that comes from clinical trial to say this is the length, and the reason is it's a novel virus. There hasn't been time for these studies that take years. So the plans going forward, usually to measure the success of opening, and by definition, the success of opening means the speed of the reopening. We have different measures to look at the virus spread and the data that we have locally, whether it's the number of cases or the doubling time, and I'll be more than happy to answer these questions if more of interest about them. System capacity, how many ICU beds we have, how many beds we have in hospitals that are empty, how many cases treated and recovered, and the final category, testing capacity. And this would be our ability to detect the disease as soon as it resurges. So we would expect that there are going to be sporadic cases, no question it's going to happen. There might be clusters, which is 2 cases related to a case or so. Our goal is to prevent outbreaks, multiple people infected by one person. And the 3-stage approach is a reasonable approach, is again from academia and has been in application in different countries, and it works. And it's based on different activities based on the risk, as the next slides would show. All these slides exist on our website. If you click on COVID link, you would find different subsectors of information and subsections of information, and one of them is directly related to businesses and reopening, and you would find all this information there. Why are certain activities considered to reopen before others? And there are different variables in the activity itself that we look at to assess how safe it is to open early or not. And we classify the risk in high, medium, and low. And the variables that we look at are the most important 3 are here: the number of people in the specific space. So that's 2-3 variables in this in one variable. The second one is the time, length of time individuals will be in contact with each other. And the third one is the distance and the ability to modify that distance. So if you look at 2 different activities at the end of each end of the spectrum, golf courses versus bars and movie theaters. Golf courses, you have a huge amount of space. There's a very small number of people who are not required to be in contact with each other. They're not a dentist and a patient in that close proximity. They're walking or driving and they're doing their golfing. So this is a very safe from risk transmission point of view to open. On the other side, when you have movie theaters or bars, you have a high number of people in a limited space, and they're sharing the same surfaces, touching the same surfaces. And with bars, you would have the added effect of alcohol, which would lower the ability to be mindful of any one of us, to be mindful of social distancing and to protect ourselves and others. So you would have these factors measured for each activity. You would find that different activities, and this is example about categories for risk of transmission. This comes from the plan for a phased reopening guide by public health principles by John Hopkins. The example is community gathering spaces, and you would look at places of worship, churches versus library versus community centers, and you would see that based on the number of people and the contact and the ability to modify, you would put them in different categories. So it is based on evidence, on science. It's not, Ian's like or dislike, or the MOH's or his team dislike or like. It is rather based on evidence-based approach. So who decides when and how reopening happens? We have our local preparation to be proactive, to provide this information locally to the businesses. Some other health units have not been involved with this, rather saying, this is occupational health, which goes to the Ministry of Labor, and you can find that approval there when the recommendation comes. So we have been the way we should be if we're going to practice appropriately in public health, supporting the community beyond our mandate. The decision to reopen restrictions, like I starts with the Ontario government lifting the restrictions on the orders that they had and the restrictions they had. And with each phase, there will be different evaluation that comes from public health and different partners around the table. So we would provide the scientific opinion and the description of the local data to ensure implementation of the process going forward is safe. And here is an example of implementation. Usually stages reopen in 2 to 4 weeks. So we have to wait 2 to 4 weeks. And this number of days, the 2 weeks, is not random. It comes from the fact that the incubation period of the virus is about 1 week. It is, 4 to 14. However, most people would be around 1 week. Then the person would have symptoms. They will be tested in a couple of days. Then the test will come back, test results in 4 or 5 days. And we will know about it after a total of 14 days. So if we release the restriction of, let's say, retail and construction, like we did 2 weeks ago in the province, we wait 2 weeks. And in 2 weeks, there are 3 possibilities, like you see them here. Either the numbers are still low, so we continue to the next phase, or we're not sure, so we lengthen the current phase, and we're not sure if we see a surge, but it's not huge, or if we see an extreme surge and an outbreak, we might retrieve to the previous stage. Hopefully, if we do it as slow as we can, as fast as we can, reasonably, we don't have to retreat. So there are many things that public health can have in the emergency response in the recovery phase. Most people think that, we have the mandate, the experience, and the ability to provide service to respond to the emergency and stop the outbreak, and we have. But we also have a role going forward to ensure we have comprehensive testing strategy, the ability to pick up cases as soon as they surface. And again, I can speak about this for 2 hours, but that's not the main goal of the presentation. We have ability to monitor the situation and the requirement for PPEs in different organizations, whether it's long-term care or businesses or the community at large. And the final one on the list is communication. Any item we study in the IMS or work on in the IMS would have a component of communication, and sometimes the item itself is communication. And again, I would encourage people to go on the website. Even if you take care of your business needs completely, spend 5-6 minutes, 10 minutes on a day on the website. There is something new that can help you personally, your family, your community, and your business by definition. If you're looking inside your business activity, what works best? The evidence has been around for years. This is before I was born even. There is physical distancing and physical measures. If you have activity in your business, whatever the business and the activity is, if you implement PPEs, there is evidence to it, but it is weaker than the administrative control. If you separate people by shift or separate, if you look at one of, for example, granular example, you have employees and some of them are older who are vulnerable for the disease, place them in a shift that's low traffic, that lowers the risk for them and lowers the risk for the business to basically lose an employee for 14 days or longer. You look over it, you see engineering controls. This is gold standard too. Physical distancing is optimal, but it's not guaranteed all the time. If you have engineering controls, I can give you an example, maybe not related to COVID, but most of us relate to. Many people worry about the microwave radiation. And the worry is really if you are exposed to it directly with the door open, the microwave door open, but all of us know that you cannot turn the microwave on if the door is open. Engineeringly, it was restricted. So you have to close the door to ensure the safety. Similarly, in COVID, you can have many measures in your business implemented to prevent the disease completely. And whether it's through disinfection or other means. For details to go granular about this, there are documents on our website, and our team would be ready to answer anything that could be more complex. Next steps for reopening, and I'm getting close to the end of the presentation. Further guidance from the Ministry of Health and the province, and reopening will likely need to be adapted regionally, locally. It is a better practice to open in a unified way across the province. That's the easiest way that secures a successful opening for everybody, and I can explain why, but this may be not the reality we're going to end up with. If we look at our numbers in Gray and Bruce and say we have done really well as a public and the business and community and government, and we're ready to open, and we open before other regions around us, guaranteed we turn ourselves into a magnet, because people will come here to shop and to have their hair cut and to have their vacation. And by turning ourselves into a magnet, we're going to see more cases coming from the other areas that have higher risk. And that's why it's a unified approach, the principle for the best practice. However, like I mentioned earlier, can we wait and see more disease and death related to the COVID measures itself? And the province is, as most of you would have heard the announcement, they're considering moving to regional, which means we would move earlier. This is more work for all of us. People get excited about it, but just be cognitive. It is not unmanageable. It is manageable, but it is more work for all of us around the table, businesses, public health, and the healthcare system, because we would really have to, from my point of view, communicate with all other health units and ensure that we can do our best to support that transition for all of us. For you, you would have to deal with more chances of a transmission locally related to that opening. However, it's a direction from the ministry that we would have to work with all of us. And there are resources on our website. I really repeated it 3 times. If I repeat it 12 more times, probably you're going to get more benefit than listening to anything any of us could say, because the information is there. There's a team of professionals who worked on this, adopted information coming from different sources and packaged it for our local needs. And these are the references, and that brings us to the question part of the presentation. And we received, I should mention, we received a group of questions. Andy and myself will be trying to answer them to the best of our ability.
Wonderful, thank you. So if you have any questions, please feel free to write them in the Q&A box. We have economic development officers from both Grey County and Bruce County on the call today. So if it's specific to your county, please feel free to ask those as well. So Dr. Arra, how do you want to move forward? Do you want me to ask some questions that we had written down, or do you want to move through the list that you have provided?
If you read them, that will be optimal. I tried my best to take a look at them, but with a limited amount of time, I really didn't read all of them. So it would be best for people to hear them, and we'll take a stab at each one of them.
Okay, so we've grouped them kind of into themes, and a lot of the questions were around masks and when is it recommended versus when is it mandatory, specifically as we're moving in and some of those services are opening where you cannot physically distance from your customers or clients. So if you wouldn't mind commenting on that.
So there is no mandate for facial covering in public places at this point. And I can explain the use of these facial coverings, and these are masks. I'm using the word facial covering intentionally. This is a term that's used by the province for the same good reasons we came up with the same term, because we want to emphasize that the effectiveness of a surgical mask or N95 or any homemade mask for the purpose of using it in public is the same. All these types of masks would have the same efficacy if you use them in a public place, grocery store, or any other business. They have specific use, N95s in hospitals and specific procedures. And surgical masks would have the same efficacy like the homemade mask. they are best used in hospitals and healthcare settings because that's where they belong to. If we use them in public places, here's what happens. There is some benefit to the individual to protect themselves that's over-countered by or countered with the harm from touching our face quite frequently. If a person is not a surgeon or a nurse and they put a mask, there is a tendency to touch the face. People who are trained to use a mask in a clinical world, they use it doff and don in a specific way, and they refrain from touching it in any way that would increase the risk. So for the public use, the benefit of protecting the person versus the disadvantage from touching our face evens itself out. The resulting outcome is protection for people around you. If you're wearing the mask and you're shedding virus, people around you will be protected. It would not be protection for the person wearing the mask. So, and there is probably here a point that I heard questions about and worth mentioning. Why did the recommendation change? Did we have new evidence about masks? No. We know what the evidence of mask and the efficacy of it. What changes the risk of their transmission in the community and the measures for social and physical distancing. So if you go back to January, February, I reported to the board as early as late January that the pandemic is coming and we're going to be in this reality. I called the municipalities and the 2 counties in February and I said, dust off your pandemic plan, it's coming. Should we have implemented mandated facial covering and mask at that time? It will be futile. There is no risk of transmission. And in March, again, the risk starts going up. In April, there was risk. In early May, there was risk. Why didn't we implement facial covering in public places? Because we had complete social distancing. It will be futile for me to wear my mask watching my TV alone at home. So there is no need to pull the trigger on this intervention. And it is a better practice to wait to the last minute that you need it to pull that trigger, because all of us know that compliance has limited time span. People would be tired with the measures, will be tired with the messaging about the measures, whether it's social distancing or masks. So if we implemented them as early as March, it's guaranteed by now people would be throwing them in the garbage saying, I can't stand this thing anymore. So we had to wait until early May, until we starting reopening, to say now it's the time for using it in public. And again, circling back to the main question, the different types of the masks, all of them would work the same efficacy. And it's better to preserve the surgical masks to where they are needed best.
Okay, wonderful. And there were some questions from businesses are they able to require their clients or patrons to wear a mask in order to receive a service? Are they allowed to say that?
This is a great question. Businesses are allowed to do things or not do things based on law, and occupational medicine, Ministry of Labor would have these laws and regulations in place. Public health cannot really comment on providing this opinion because more or less it's a legal opinion or regulatory opinion from labor point of view. Public health in general works all the way to the front gate of a business workplace. Does not go in unless there is an outbreak. However, because it's emergency, because it is a pandemic, we have went over our mandate to provide services, to provide advice. However, it's only advice. So my understanding, and I'm not a lawyer, and please don't take this as a direction, for me as a manager in the health unit, I'm the CEO, and I know I can mandate certain things based on the risk. And I would usually go to to the Ministry of Labor or to the legal that supports the health unit. So that's the best place to go for it. Hospitals, I've worked in hospitals as a physician, and they mandate masks in certain places. So my understanding, you have the ability to do this. However, I cannot give the direction to do this.
Okay, perfect. And maybe we can even, I'm trying to think of who the best resource, perhaps with the Ministry of Labor be someone to speak to in that regard about mandating masks? Just so we can maybe get a little more clarity.
I should add here, if the risk of transmission in Grey Bruce goes sky high and there are a number of deaths, the MOH can issue a local order to say mandate it to everybody. But I don't see this is needed at this point because the risk is low and because the compliance from the public has shown that education is as effective as an order. There is a principle in public health practice that I honor on daily basis in different decisions. It's the least intrusive. If education works, there's no need for warning. If warning works, doesn't need requirement for an order or a fine. And if I may ask Andy to provide more information about inspections of workplace for different reasons, not just for the mandated of a mask. He can provide that lens as well.
Mm-hmm. So, I assume, depending on the sector you're in, that there are businesses out there that are regulated by us. So those are the ones that we would be in, typically for fairly defined reasons. What we are doing, both in terms of good practice and also at the request of the ministry, when we're doing inspections, which we, for a period of time, have been doing very little actual face-to-face contact, but we are starting to get out a little bit more now in keeping with the reopening. So we will be able to give a certain amount of guidance on sort of COVID-19 restrictions and things, as well as our regulatory stuff. So yeah, masks certainly will be one of those. But I think going back to the slide that Dr. Arra showed earlier on, it's important to understand that PPE is probably one of the least effective things, and there's a lot of other measures there that we can be looking at in terms of physical separation, in terms of potentially either screens or the sort of organization of the order that people walk in, if you've got different rows, different doors, that kind of thing. And then there's sort of administrative controls, like the maximum number of people in a certain area. So there's quite a lot of things that a lot of the people listening to this will have already done that fit very well with that hierarchy.
Thank you, Andy. I think you're on mute.
Thank you. The next question had to do with workplaces when there are more than 5 people in the workplace. Is that permitted, knowing that we're not supposed to gather in groups of more than 5 people? And if it is a workplace that has more than 5 people and they can't socially distance, what kind of measures should they be putting into place?
So from risk point of view, the number 5 is not a magical number. It's not, under there's no risk whatsoever, over there is risk. It's a spectrum, and the lower you go, the less risk there is. The order currently is 5 people gathering. In a workplace, again, the regulation itself, my understanding of it, and I'm not the expert in this, it's a legal question. Is this legal or not to have it? My understanding, it's as long as there is enough space and social distancing, it is allowed. Even we have meetings of 6 people in the same room. We have a classroom that's huge, and we have 2 meters between people. We're not, in the health units, essential work more or less, but going forward with reopening stages, by definition, the risk is less. And if this is going to be a legal barrier, I suspect the province will change that number accordingly to allow it, if it is a legal barrier, and I don't suspect it is. Any thought, Andy, about that?
Yeah, just to give a little bit more, perhaps, I think we may see that number 5 change, but also just as a reminder that 5 is really for organised public events or social events. So for businesses that are on the essential business list, and we're obviously seeing that list expand week on week right now, then that list, that number of 5 doesn't apply when it comes to employee numbers. And now the general advice of keeping numbers low, of course, applies, and physical distancing and the various other measures we've talked about. And I do know, for instance, that some employees that have quite large numbers are doing fairly innovative things. They're staggering shifts in a different way to normal. They're organizing breaks and lunch in completely different ways, as well as perhaps engineering controls like screens and things. So there's a lot going on that can reduce those risks, reduce the numbers. But ultimately that 5 is not a hard and fast number for those businesses.
Good to know that doesn't necessarily apply within the workplace. Okay, perfect. We received quite a few questions today around short-term accommodations, just due to some news that they will be the next to start to open. Would you mind commenting on that? And maybe, I don't know if economic development wants to comment as well about short-term accommodations in Grey and Bruce County, and if that will be moving forward this week.
Sorry, the first part of it, if you can repeat it.
Oh, just in regards to short-term accommodations, and if they will be permitted in Grey and Bruce County in this coming week, as we were hearing in the news.
I wouldn't be able to comment on it at all. Short-term accommodation, is this?
It's today's regulatory change, so it's very new. The regulation came, I think it was, the amendment was released around about lunchtime today. So, which supported, I think, the statement that was made yesterday. So we haven't had a lot of time to look at that yet, but in essence, it adds short-term rentals onto the list that previously was hotels and motels.
Is this the same accommodation question you're asking?
Yeah, so they just wanted some clarity around if Grey and Bruce will be involved in that phase of opening next week. And then there's quite a few questions around, so if we do go ahead and open short-term accommodations, there will be a lot of traffic of people coming in and out of the residence. Where are the best resources for them as far as guidelines on cleaning principles and things like that? Would that be your website?
Cleaning, there are plenty of information about cleaning, not specifically for this, but it is quite applicable. Sorry, when you said accommodation, I understood the word totally different. I didn't understand the rental. I thought accommodation of work shifts to accommodate your employees. My bad. Like Andy said, the regulation came out yesterday, and the announcement yesterday, the regulation today. And we will be supporting any questions related to this infection or other parts of this. There is the other question is, do you have any plan to restrict further than what the ministry would? And I have, from the data I see, there's no need at all to restrict at this point. However, we're monitoring the situation going forward.
Okay. Sorry, I'm just there's a bunch coming in, so I'm just going to go scroll through. Rob, if you see any that I have missed and you want to address them, can you let me know as well?
For sure.
I think there's some, people looking for a lot more clarity around short-term accommodations, and we'll work on that too and make sure that we share that out with everyone who's participating today and that it's shared adequately on our sites. Okay, so we have another one, and again, it's pretty specific to their industry, so I'm not sure if you will be able to address it, but it has to do with outdoor activities. And for example, this individual has a yoga studio and their classes are held outdoor. So they're wondering about, again, when they open, the number of people and their ability to have classes. What exactly will mandate that?
So this would be direction from the ministry, usually an announcement followed by regulation. And there will be in the regulation certain recommendation to modify the activity. We can predict certain things, like I mentioned, and the information is on our website. However, it's really difficult to be 100% sure what is going to come out at what time and in what level of restriction or modification it would be. I don't know if Andy can add to that.
I think that's perfect. What I will do is I'll add an example. So there was a lot of discussion about day camps, whether or not they will be able to open. And obviously that was an announcement that was made relatively recently. That came with a guideline. We were waiting for the guideline. A lot of it is very much what we would expect to have seen. One of the particular guidelines was to maintain cohorts of campers and volunteers and workers, a cohort of no more than 10. Now that as Dr. Arra was saying about the number 5, it's not, again, it's not a magic bullet. It's, I think, quite a reasonable number, but it's not necessarily one that we would have landed on. And that's one of the challenges where if we try to preempt the guidelines coming out with sort of hard and fast data, we might have said 8, we might have said 12, or perhaps we wouldn't even thought of an exact number for the cohort. So it's the planning documents and the ethos behind it is all good, but we very often just have to wait to see where the province lands with those details.
Okay. Perfect. And I know we had quite a few questions about areas of service that aren't open yet. And I know you can't speak to when they will, because it all is going to depend on what is happening regionally within the province. So our apologies, we won't be able to address those ones, but obviously it has to do with what's happening in our area. There's another one in regards to temperature and your thoughts on using that as far as screening employees coming into work. Do you think that is a necessary measure or a valuable measure?
It is definitely one of the measures that are known. Is it cost effective and socially acceptable to be done? That's really different depending on the setting. If you look at EMS, some services, ambulance services, use testing, screening their employees before their shift. If you look at the grocery store, it might be even more risky to actually go measure every person, to actually make them stand in front of a person, have a specific distance, and have some verbal conversation around it. It might be not much added benefit comparing to the passive screening. If you have a sign at the entrance of a business saying, if you're ill, if you don't feel well, if you have fever, if you have these symptoms, please don't go in. Most people would do the right thing. So that extra measure of testing temperature objectively might work on a very small percentage of people who, at the end of the day, they might even have symptoms without temperature, and they would be shedding the virus without temperature. So it's again, it's an added value, but is it cost effective? I would say it's not worth the recommendation for the general business. However, look at your own activities and the number of people who would go in and how much risk there is, and it could be considered for high risk activities that are clinical, for example.
Okay, perfect. So there are a couple more in regards to the fact that it's looking like we will be offering short-term rentals in our area in the very near future. And some business owners are asking if they're making the decision whether or not to open. In your opinion, is it safe? Is it responsible to be encouraging people from out of the region to come, knowing that that's who they would most likely be offering accommodations to?
Again, it goes back to the first slide of balancing the risk from COVID versus the risk from measures against COVID. And, at some point we need to go back to normal life, to reopen all the way with safe modification to lower the risk, makes it acceptable until we have the vaccine or enough herd immunity. It really depends on many variables, like I counted. Currently, we have a low number of cases, acceptable risk that would allow us to move to the next stage safely, and we'll evaluate for 2 weeks and see. Now the provincial direction says this is allowed, and we have the environment to actually go forward with it and implement it, and we continue to monitor. More specifically, if I'm going to go granular, hotels are open, have been open. And there's nothing to say that a person who's renting a room and managing that specific room would do a less job in disinfection comparing to a hotel. Again, all of us can do our best to modify the activity we do and be mindful about ourselves and people around us.
Wonderful. I think I might know the answer to this one, and I don't know that it's going to be, okay, I was just going to ask it. They're asking, as they're developing their opening plans and the measures they're going to put in place for their employees and patrons, is there someone or an agency who could review that for them to let them know if they are covering all their bases?
Indeed.
So, I think reviewing with a sense of approval is something more than the health unit can realistically do. We do want to be there for the public. We want to be there for the business community as much as we can. And that certainly includes having conversations, answering emails, trying to give as much guidance as we can. And just to reiterate another time what Dr. Arra has already said, we have a lot of really good guidance that both we produce and links to from other agencies on the website, and hopefully people can find a lot of the answers there as well. I will note that as a small-ish health unit, certainly not one of the big ones, there is finite capacity, and as much as we want to obviously continue to help people, that there is perhaps a limit, and that might be, we might exceed that limit before we could approve something for every business in Graham Bruce.
And if I may add to this, there is a legal barrier. If there is a business with a union function in it, or if there is an issue where the employee said, I don't feel safe. We know all of us in Ontario, our law allows us to not work if there is an issue of safety. For those specific scenarios, public health vetting the plan would not be appropriate. It would be the Ministry of Labor, and my understanding, correct me, Andy, if I'm wrong, there are 22 inspectors who work for the Ministry of Labor who have been very active and have done a really good job attending to these issues, where they would look at the business and from their point of view and guidance or regulation, they would say, this workplace is safe, or this workplace requires this modification, and when it's done, it is safe. And at that time, the legal aspect of it will stand. Public health can provide recommendation in this case. We're happy to help as much as we can. The website has a tremendous amount of information, and it's really categorized in a way that every person, literally every person I sent to that website or send a link to came back with the answer. Thank you so much. This answers all my questions. I wonder why more people didn't know about it. Or I didn't know about it before. So again, too much communication is not enough, and we're doing more of this, and including this session. If people have a very specific question that they couldn't find the answer after going through all the documents that exist, we'll be more than happy to try to help. Again, you can appreciate there are many types of businesses and subsectors of businesses and activities that are specific to each location. Like Andy said, we might not have the resources to answer every single thing or approve a plan. However, the website would have the bulk of the general questions answered right there. Yeah, if I may, Andy, I mentioned the 22 inspectors. Is that the right number? Or
There's certainly a number of additional inspectors province-wide, and we do know that there's active inspections going on in the area. I actually don't know the exact number of inspectors that are in this area, but they're certainly active. And actually, I've been remiss, I should also mention the Ministry of Labour have quite good detailed documents on sort of industry-specific areas as well, from that point of view of employee safety and things.
If Andy didn't know the number, please don't quote me on the 22 inspectors. If they're hiring more, that could be even better.
So one of the questions that seemed to be a theme was businesses having trouble differentiating between the guidelines on your website, which are a great resource, but whether or not those are simply just guidelines, or if they are things that they must be doing, especially for some of the smaller, maybe sole proprietors, independently owned businesses, in regards to renovations and things modifications they should be making to their spaces. So a little bit of guidance over how they know what they're required to do versus what is just suggested or recommended.
So what we have on our website is general guideline. We will really have to wait until the announcement from the ministry is followed with the regulations, and the interpretation of these regulations would be the what is mandated or recommended or is at the time. So our website has general recommendation for better practice.
Perfect. Okay, that clarity is important. That's great. I think we've covered all of the main topics. Rob, did you see any major themes that I may have missed?
Not themes. We do have some specific questions in here. If we have time, we can maybe go through a couple of those. So there's one here, Dr. Arra. I don't know if you can comment or not, if it maybe it's more at the provincial level. It's regarding hairstylists, and I think I'm probably not the only one in this call who has been subjected to a quarantine haircut. And what are your thoughts on hairstylists when they might be able to get going again? They are, by a lot of means, considered a trade, and they are regulated, whereas a lot of retailers are not. Is that something that could reopen safely soon?
So like you rightly pointed out, this decision would come from the province at the time, at what time they would open, with what modification. And if you ask me to predict, I would say it's not going to be in the first stage, not in the third stage, in the second stage. The activity is a close contact, and there's quite the proximity in it, but at the same time has many regulations or protocols to ensure lower risk of lower risk of infection. And as a matter of fact, our health unit inspect many of these businesses. So that speaks to the fact that it is regulated. And that's why it wouldn't be in the third stage. But again, this is an estimate. All these reopening plans that are developed by us or developed by other sources are documents that answer the question of what, not the question of when. More specifically, what would open at stage 1 or 2 or 3 as a prediction, but not what date it will take place. Those things are evaluated on 2 to 4 week basis going forward.
Okay, we have someone asking, and Savannah, you might maybe want to comment on this one as well. They're asking if you guys know of a resource where they're able to access stickers, decals, posters for their customers. They saw the hand washing poster on your site, but that's all they were able to access. Do you know who else might have resources?
Andy?
So there are quite a lot of resources on or linked to our website for a number of different things. Probably the one we're not going to be able to help with is some of the sort of physical distancing. So, you've probably seen a lot of places have arrows or crosses or foot marks, those kind of things. So that's not something that we have. It would really be very specific to the individual location. But when it comes to language that could be used for passive screening or hand washing messaging, that kind of thing, then that should be accessible from the website.
Perfect. Anyone from Bruce County? I don't know if you guys are providing any resources directly to your businesses or Grey County. We can follow up on that one for sure.
Sorry, I was still muted there. That is, it's something that Grey County is working on, coordinating those resources. In some cases, not necessarily the decals, but some of the other signage, we're looking to actually put a package together for businesses that you can download. Some of the pieces will be physically delivered to your business. So that is in the works for Grey County. We were just looking at this morning, so more to come, and we'll make sure that we do follow up with all of the folks participating.
Thank you, Savannah. So there's one more that's quite specific, and I'm going to throw it out there because I'm not sure what the answer is. So this is from a business who works directly with adults with a variety of disabilities, and they work one-on-one in a very large space, so they can distance quite well. Are they allowed to open at this present time, or are they still in a future phase?
What type of business, sorry, other than large space and working with people with disability with ability to distance? Is there a title for that business?
It just says they work directly with adults with disabilities and typically all out of their space. So maybe if they can give me a little bit more clarity.
In all cases, really, those questions about what type of business opens or not, it's usually provincial direction, and there is a provincial number where most people would call to find these answers. And if it is tricky enough not to be known, it wouldn't be us that would make that decision.
Perfect. So we will make sure that we get that number and share that out to everyone who's on the call today as well, just for those more specific questions. Okay, there's a question about our beaches and what are the implications of transmission on the beaches once they are open? Is there any evidence that this is a risk?
So the risk of transmission, again, relates itself to different variables, whether it's the beach or any other place. It's the proximity of people, the length of time they're together, and the type of contact they have. If somebody's walking or running on the beach, it's no different than walking and running on a sidewalk. If sports related to water sports, swimming is not a risk for COVID transmission. It is the gatherings, the aggregation on beach that is worrisome. If you find a few hundred people gathering in a tight space, that is the risk. Again, it's not related to the beach, it is just in general.
Okay, perfect. We're getting a lot more questions about short-term accommodation, and I think where we're going to be at with short-term accommodation, just being that it is so new and was only released today, we're going to go back and do a little bit more investigating for the businesses, and we'll share it out, and we'll make sure it's posted on both Bruce County and Grey County sites so that our tourism-based businesses have the most up-to-date information. And I think the rest, unfortunately, are questions that are going to be answered only as time passes. There's quite a few about restaurants, but I know that's another area where it's going to come down from the province, correct?
Correct.
Yeah. Okay. Rob, are there any others that you're seeing that we might be able to address?
That's all I'm seeing right now, Courtney.
Okay. Okay, sorry, one last one, and I think we know the answer to this one too, just based on the fact that it is mostly guidelines that you're presenting, but it's in regards to the plexiglass in retail spaces and whether it is just encouraged as a best practice or if it is something that you would like to see in all retail outlets.
It really depends on the location itself and the activity. If there is enough space distance-wise, it might not be as effective as if you find an activity or a space that is very limited and people would have to talk for a length of time. Any specifics, Andy, beyond that?
No, I mean, I think again, you know, it's an engineering control. There's good evidence that it is helpful in certain circumstances. But as Dr. Arra alludes to, it really does depend on those circumstances. And you know, business owners very often kind of have a feel. If you know that it's a small till area and you are essentially almost face to face with your customers on a regular basis, then that's going to be a much better candidate than somewhere where, you know, you've got 6 or 7 feet between you most of the time, and maybe not so essential. Definitely not mandatory, but definitely a useful tool in the right place.
Okay, that is helpful. Yeah, I guess there's just has that feeling they want to be doing, you know, what they should be, and they're doing the absolute best. So this helps give some clarity for sure. I think the rest are quite specific about cleaning and yeah, the different services and the different things are going to be the tools that they use and how to properly clean them between customers and clients. And again, I think probably your website is going to be the best resource for those items.
Yes, definitely. The disinfection documents come from Public Health Ontario as a source. They are protocols that are known in different settings, and they have evidence behind them, and they're quite easy to understand and implement. And the virus itself is not hardy one, so going to our website would be more than sufficient.
Okay, perfect. And I know you mentioned there's a number that we'll share with everyone that you can call if you have specific questions about your industry and if you are able to operate or not. Because we're just having a couple more come in about specific industries and why they are in the phase they are and when they will be open. So probably best to contact that number. Okay. So we'll make sure we share that with everyone following today's session so that you can reach out and get a little bit more clarity. So I think,
Brittany, did you see the question about the computer house calls for computer help for seniors? Just wondering about best practice to keep them safe.
I just saw that one come in. Thank you. So yeah, when working with more vulnerable populations, is there best practices that you do recommend when going into their home or their space?
It's the same recommendation in general. If there is a way not to go into the space, that will be optimal. If there is any way to deliver the service or the activity, that will be optimal. If somebody has to be in, minimizing the length of time, reducing the contact, ensuring the 2 meters distance if possible, all these things would still apply. Hand washing is essential. You know, you can repeat it 10 times and it wouldn't do it any justice. All these measures are would still apply. Anything, Andy, there?
I think, so the question I think was partly about bringing computers in, or was there a...
So sorry, yeah, the question is they go directly into a senior's home to work with them on their computer. Yeah, and they were just asking
on the
when
computer.
in that space. Yeah.
Right. So, I mean, I guess that's where, if there's any kind of shared surface, then looking at the sort of disinfection protocols would be important as well.
Okay, perfect. I know it's tough. I know, and I wish we could, and I'm sure you feel the same way, give some very clear specifics on what's best for each business, but it really is going to be dependent on the service you offer and how you offer it. So that's why there's such wonderful resources on your site, which we will share out again. One last one, if you don't mind, just in regards to washroom facilities in buildings and customers using those. Is that something that they should be doing, opening them up to the public? And is there, I'm just making sure there were a little bit more, or maybe not opening up the actual facilities in their building, but offering a porta potty option if that's possible?
So I think there's two elements for this. So, you know, we've talked about a lot of the things that we've got on the website as being guidelines, which is true. But the regulations themselves from the province are obviously not guidelines, those are mandatory. And some of the specifics for some of the sectors have language around washrooms that either they are not yet to be open or they can be. So that would be important. That's the first step, to make sure that what you're planning to do is permitted. Assuming that they can be open, then obviously you then get into the guideline aspect and ensuring that cleaning and disinfection is optimized, likely more than you would normally do. One of the questions then we often get is, well, if I do it twice a day, is that adequate, or 4 times? Those are really hard questions to answer because it depends on the usage, it depends on the numbers. But certainly, those frequent contact points are something that do need to be looked at and disinfected.
Wonderful, thank you. Okay, so I think that wraps up the majority of the themes that were covered, and we will be following up on today's webinar with sharing a whole bunch more resources for everyone who participated, as well as a recording of today's webinar, so that you can rewatch certain sections if you need a little bit more clarity. I just want to thank you both. I know you're incredibly busy individuals right now, and thank you both for being here today and sharing all your knowledge with us. So thank you.
Thank you.
Thank you for having us.